Welcome to the Business of Healthcare, a twice-monthly podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Britt Barrett. We have with us today Marilyn Moon. Dr. Moon is the former chair of the Maryland Healthcare Commission and currently serves as a fellow with the American Institutes for Research. And she has embarked on a number of very noteworthy projects and efforts, and we're just delighted to have her with us today. Marilyn, welcome. Thank you for joining us.
Well, thank you for having me on.
You have been a participant and led a very interesting initiative, and it relates to pricing transparency and communicating to the consumer the cost of healthcare. Can you share with us a little bit about that and what that means?
Certainly. The Maryland Healthcare Commission, a number of years ago, started to try to provide better information to consumers on a whole range of things. Everything from information about how to choose a long-term care facility, and so forth. But one of the things that had never been done and is very difficult to do is to combine the notion of the costs of healthcare and the quality that people receive when they get that particular kind of healthcare.
Let me pause for just a moment. I find that fascinating. Do you not find that fascinating? I mean, we've been in healthcare decades, right? And we talk about cost and we talk about quality, but there's been very little effort or success on combining. But that's where you guys went, right? That's what you decided needed to be done.
That's exactly right. And part of the reason it doesn't happen is that there are people that collect quality data and there are people that collect cost data, and they don't talk to each other. And they're usually different organizations, et cetera. So it's very difficult to put it all together.
Well, but you did. And the work that you have, there's a great website, wherethecost.org, that is pulling that together. Tell us a little bit about the evolution of that and where it stands today.
Well, as I said, the Maryland Healthcare Commission has been working on this for a very long time. And what they have tried to do, and I was the chair a number of years ago, and it has been carried on by my successors since then. So kudos to those folks as well as the professional staff on the commission, to try to find a way not only to pull this information together. We began collecting data on costs and quality a long time ago, but you have to both pull it together, but more importantly, in many ways, is you have to find a way to boil it down so that it is useful to consumers. As a researcher, I'm intimidated by the amount of data that's out there. And when you look at some of the databases that you can work with, it's very difficult to figure out how to do it. So you have to boil it down, and then you have to put it into a form that is user-friendly for people. And that's what the effort has been over a large number of years now. And what they came up with, I think, was very clever. I wish I could claim credit for it, but this was past my time. But what they did was essentially take initially 4 key procedures that people have the option of doing and have some control over. They're not emergency procedures like when you break your leg, you're not going to talk about cost and quality. You're going to just get the care given. But if you're going to deliver a baby, if you're going to have a hip replacement, for example, you're going to think ahead of time, where do I want to go to get the care? And so that was the whole goal here. Let's show what it costs in different hospitals in the state of Maryland to get this care. And let's include in those costs things that might affect or indicate what's happening to quality as well. Are people readmitted because of problems that occur after their procedure, for example? And those costs need to show up, and they need to be highlighted as potential quality issues as well.
Interesting. Who made that decision? I get the costs. We can run the reports and the numbers. But what about the quality indicators? You mentioned readmission rate, and you've got 4. You've got hip replacements, knee replacements, hysterectomies, and vaginal delivery costs, right? I think those are the 4 that
that you focus
So far.
on? Yeah, so far.
That's right. And they're going to be adding more. They're going to be adding more years and more hospitals and more procedures over time.
So you hit a quality measure of readmissions. What else did you look at?
There are not a lot of quality measures that you can grab from the cost data, and that's a
Right.
real problem.
Yeah.
Because again, you have to go where you've got consistent information. And so one of the challenges is to get that information. And over time, as we improve quality measures and as these things get better integrated into the system, then ideally there will be more measures of that sort. So at the moment, the quality measures are fairly limited, and readmission is the key one that people look at right now, because that says something went wrong and you had to come back into the hospital. And they focus not on all possible readmissions. You know, you broke your leg after you delivered a baby. That doesn't count.
Right.
They go after things that are potentially preventable events that either happen in the hospital or at readmission.
Well, I bet there's a dilemma because we start talking about nosocomial infection rates and people's eyes glaze over because we've used all this medical jargon. And I totally get that. But you envision the consumer to really take this information and go with it. Am I right? Is this really a consumer-facing opportunity for sharing information?
I think this is one of the best consumer-facing websites I've seen for this kind of thing where you're looking at procedures, because it tries to be very simple and straightforward. It doesn't boil it down to all the details. What it says is, here's the basic cost that you can expect. Here are costs now broken down into a couple of categories. One of them, for example, being infections and other events that should not have occurred but did occur in this hospital at this rate, and therefore that adds an amount to the cost. So you're getting a total cost that has a number of components to it, the standard stuff plus extras.
I agree with you. It's one of the best I've seen. I'll give you a little anecdote. We here at the University of Texas at Dallas at the Jindal School of Management, we have an undergraduate program in healthcare management, and our intent is to prepare the next generation of healthcare leaders with really strong business acumen. And one of the class homework assignments is to contact a hospital or healthcare provider outside of the Dallas-Fort Worth area where we're located, outside, and determine or ask what it would cost for a hip replacement. And I would say it's the most frustrating thing for my students. 70% can't get a number. And when they call, and it's someone even international, the pricing variation is staggering. It's anywhere from $16,000. Then we had one hospital, which I won't name, $120,000 they quoted for a hip replacement. And, I kid with the students. I say, you could rent a jet and fly out there, stay at the Ritz-Carlton, and come back. But then I push back and I say, yeah, but what kind of quality are you getting from that? And once again, blank stares. So kudos to you. What's the reaction been from the professionals out there?
The reaction has been pretty good. Everybody always gets nervous when you put information out like that, because it's, have you controlled for this? Have you thought about that? We have special circumstances. And so, but you have to start somewhere. And one of the things that they've done is try very hard to adjust for certain things, adjust for differences in the health status of the patients that are being admitted. So if one hospital gets sicker patients than another hospital, you want to take that into account, for example. And of course, one of the things that hospitals legitimately object to in many cases is, well, we can't control the costs of physicians and other people, but patients want to know what the whole thing is going to cost, not just what each piece is going to cost. And that's what this website also does. It looks at not just hospital costs, but physician costs, so forth.
Is it illuminating for these docs to see the numbers? I mean, have you had any of the professionals say, hey, I had no idea?
Anecdotally, I've heard a few, yes, who are very interested in that. And in general, when you talk to physicians, they're busy people and they don't pay a lot of attention to the costs of tests and the costs of a stay in a hospital, et cetera. And so they're blown away in many cases by, as you say, the variation that exists out there. even in a state like Maryland, which is a heavily regulated state, there's enormous variation in costs. And that's something that I think over time, not just consumers will push on, but other professionals will say, why is this difference there? And in fact, I think that's one of the goals of this website as well. Let's not just have consumers say, okay, I'll find out what the costs are and make my decision. But you also want people who can affect those costs to pay attention as well. You want hospitals to say, why is it more expensive at our hospital than another hospital, and what can we do better? And my hope is that this is a website, and these are pieces of information that will be used by all sorts of folks. Employers who are negotiating with hospitals for, are they in their network or not? Insurers that do the same kinds of thing. Hospitals, doctors, everyone involved ought to have a stake in trying to figure out this, because none of us want bad ways of controlling costs. We want costs controlled for good reasons and to get rid of unnecessary services, to streamline things where they can be streamlined. We don't want anyone coming in with a hatchet and dealing with costs. And the only way you're going to do that is if people actually know a lot more about why costs vary and what can be done to change that.
You know, it's so true. We've taken, as you mentioned, a hatchet just to cut costs. We haven't said, what's the bigger picture? You know, what are the readmission rates, the infection rates? And it sounds like you're bridging that gap of information. I will tell you, a dynamic that we're seeing nationally has been the increase in high deductibles, where before an individual might have, you know, very little skin in the game because their healthcare insurer has negotiated discounted rate and they have no idea what the real pricing is. They just know what their part is. But as people move to $5,000 and $10,000 and $15,000 deductibles, they're very price sensitive. They're very interested in what procedures are, and you guys are ahead of the curve on that because they're asking, and providers have time and time again said, well, that's too complicated, much too complicated.
Yes, actually, you've hit on one of my real pet peeves, and that is if you raise the deductibles and you expect people to be good consumers, but you give them no tools to be good consumers, what on earth do you expect them to do?
Absolutely.
They're powerless because they're one person at one point in time, and healthcare, you don't buy in bulk. You buy it when you need it, and you get just what you need. And particularly then when it comes to things like emergencies, you're not going to lie on the hospital gurney and say, and how much are you charging me for this? So I think we need to recognize that when people talk about consumer empowerment, many people think that means raising the deductibles and then you're done. It's their problem. We've passed it off onto them, but it's really not. It just means instead of consumer empowerment, we have consumer impoverishment if there's nothing we can do about it. So I think that tools like this, but other things are also going to be necessary. That is, there needs to be information on when you don't even need a procedure, for example. The tool that we're talking about is what it costs to have a hip replacement, what it costs to have a knee replacement. But you also need to have the discussion of when should that occur with a physician, and is it necessary? Is it time for me to have that? And those are procedures that everybody pretty much agrees are necessary. But there are some operations, and there are some even within those categories, times in which people should not be undertaking those. So there's a whole lot that needs to be done here. We've only touched the tip of the iceberg.
Well, and not to go too far afield on this, but if I'm made aware of the cost of some of these procedures, they're enormous. I mean, it's more than buying a car, sometimes even a house. And we know that one of the determinants of healthcare costs is really behavior. I mean, I'm hopeful that when you see this kind of information, there will be greater accountability and responsibility on the individual to say, to your point, is this the right time to have that? Or how do I change my lifestyle so that's not necessary? I think the orthopedic surgeon's activity is grown with the size of our waists and the demands that's placed on these joints. And I just can't help but think that is also going to be impacted. Your thoughts on that?
I think that's absolutely right. I totally agree with you. I think that many people have been shielded from the costs of health care. that if your employer pays a big chunk of your insurance premium, if and Medicare pays a big part of the cost of healthcare, most Americans don't have a clue how expensive healthcare really is. And in fact, some of this discussion about the Affordable Care Act is when people have to face the full cost of insurance, they're aghast and incensed at how expensive it is. Unfortunately, many people hope that there's a simple, easy answer. It should just be less expensive. We all agree on that, and let's move happily forward.
Right.
But it doesn't work that way.
No.
As long as a hip replacement costs what it costs, and delivery costs what it costs, and so forth, you're not going to be able to lower the cost of premiums readily until we get a handle on all sorts of aspects of healthcare. And that's a job for everybody, consumers, providers, insurers, employers, the government, everybody. And anyone who promises you they have the easy answer and they're going to lower premiums, run the other direction.
Now, the work that you've done has been innovative, it's been creative, and it's absolutely been collaborative. The Healthcare Commission in the great state of Maryland is leading the way. You've had some partners that have helped you. Tell us a bit about them.
Absolutely. One of the key places that helped with this was a group called Altarum, which is in Washington, D.C. and elsewhere. And they are trying to push very hard to work with states and other interested parties to produce these kinds of data and make them available to people. So I think it's very important to recognize that you also need innovative partners, and Altarum is that.
Well said. Well, we'll put their contact information for those that are listening on this podcast onto our website, so you can click on that. We've got to have great partners to work with. Any final words before we close up today's podcast? Any words of encouragement or advice or suggestions?
I think the words of encouragement are that we've come a long way from where we were a few years ago, where people thought it was kind of unseemly to ask about costs. And one of the things that a website like this says to people is, this is a totally legitimate thing to find out about. It's totally legitimate if you have a choice of hospitals, for example, to think about where you want to go when it's an elective procedure. It's totally legitimate to ask your doctor why his costs are maybe higher than someone else's. And until we do that, we're never going to have a very legitimate conversation about all of this. So my hope is what we're seeing is not a change that's going to happen and solve our healthcare problems overnight, but the beginning of more and better conversations.
Well, this is but one of those conversations. I'm just delighted to have you. I'm with Dr. Marilyn Moon. She is an Institute Fellow at the American Institutes for Research. She is the former chair of the Maryland Healthcare Commission, and she is blazing new ground with a new initiative, wherethecost.org. I'd encourage you to go online, check it out. Also, thank you for your time. This is Dr. Britt Barrett with the Jindal School of Management at the University of Texas of Dallas, where healthcare is our business. Thank you very much, and have a great day. Thanks for joining us here on the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episodes, notes, links, and more. And be sure to subscribe to the Business of Healthcare podcast on iTunes or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Centers and Institutes tab on the navigation menu. I'm Dr. Britt Barrett, Director of the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.